So hello everyone, the next topic to be discussed for today is the basal ganglia, or I can say better basal nuclei. So please remember, the word has been updated in the latest textbooks of anatomy as basal nuclei because that seems to be better understanding. So let us break the words. There are two words, basal and nuclei. So basal is referring to the base of something. So of something means here brain obviously. So cerebral cortex. So I can safely say that these are the subcortical masses of gray matter, and they are located in the basal part of the white core of each cerebral hemisphere. Now, having understood this from the basic terminology of basal ganglia, this is a tricky topic also. You need to understand this topic well. I am providing you the best notes for basal nuclei. I have fetched from multiple sources, all the information assembled into one place. So it shouldn't be a problem to do this topic in any form, be it MCQ or be it your theory exam, long question, short question, anyway you will be able to answer and draw the diagrams for this topic, okay. And I will show you some 3D animation in a while. First I need to acclimatize you to the terminologies to be used here and the schematic representations. So first and important foremost question in this topic is that this group of nuclei is located lateral to the thalamus. We have yet to discuss the thalamus in a while. Now, since these basal ganglia, which is the famous words which you will see in the most of the textbooks of anatomy, they are located in the CNS we are talking about. Hence, the term is labeled as basal nuclei now. Better word is basal nuclei. Okay. Now, this misnomer which we have talked about, this is because the collections of the neuronal cell bodies is what we are talking about, okay. So in PNS we label it as ganglia, in CNS we label it as nuclei. So I think you already know that, and this quite makes much more sense to you now why it is known as basal nuclei rather than basal ganglia. Now we come on to the most important area where you get the questions as per NMC competency also in theory exams, and in MCQs also you will get this kind of basic information. The first and foremost is what are the functional components of basal ganglia, okay, and what are the anatomical components of basal ganglia, okay. So all of them which are listed here 1 to 6, they all are the functional components, okay, and anatomical components are only 3. So let me use the same color: the corpus striatum, claustrum and amygdaloid body, okay. I will explain you all these, don't worry. So talking about this, these all are the functional components, okay. Now understand, functional components here we are meaning as the first one and the most important term which you will hear is corpus striatum. Now again break the word. Corpus means body, okay. Striatum means something which is, striations are there, like cross striations you might have heard, okay. So now what are these things? See, initially during development what happened, there was a single mass of the nucleus, okay. Then what happened, suppose if this is representing the single mass of basal nucleus, corpus striatum if I talk about, okay. So there were intervening internal capsule fibers, okay, which started going inside this, and due to this intervening internal capsule white fibers, the internal capsule is white matter. So those white matter fibers, they produce the striations. So now you can see this became striated. That is the reason why we are calling it as corpus, means body, striations within the body. There are serrations produced due to the internal capsule fibers, and these serrations or striations which are produced of the gray matter, what are these known as? These are known as cellular bridges. I will show you a photo of this in a while. Now see the components of the basal ganglia. This is very important area. So first and foremost is corpus striatum. Now corpus striatum has two parts. One is the lentiform nucleus and the second one is caudate nucleus. Okay, so corpus striatum has two parts. Okay, don't get confused, be very clear on this, because this is the most common area where students commit mistakes. Let me write the commonly asked MCQ highlighting here. Okay, now see, lentiform means lens shaped. Okay, so you will see in a while in a section. So this is kind of shape which you will get for the lentiform nucleus. Okay, so this lentiform nucleus has a medial part and a lateral part. Okay, lateral part you will see it will be a little bit darker as compared to the medial part, and that is the reason why we are labeling it as Globus pallidus. Pallidus is pale looking, less gray in color. I will show you the specimen in a while, but see, medial that is Globus pallidus, lateral is Putamen. Okay, so get this orientation clear. I will show you in 3D in a while. And this Globus pallidus is also known as paleostriatum or pallidum. Simple. I am not dirtying the notes too much. I am just using the highlighter to make you understand. Most of the things are already printed and written by me. So nothing to worry, nothing to panic. Don't keep on writing during the classes. Just try to memorize the stuff, listen to my voice and memorize the stuff. You can use these videos for a recap revision also by watching on 2x. If 2x is more, then 1.5x is also okay. Okay. So lens shaped, that is lentiform, we all know. Now medial is Globus pallidus, which is known as paleostriatum or pallidum. So if I am using a word or seeing an MCQ mentioning pallidum, so that itself means they are asking about Globus pallidus specifically. They are not talking about corpus striatum to be very frank. Okay. Now see, Globus pallidus has further two parts, Globus pallidus internus and GP externus. Now these externus and internus are separated by medullary laminas. Okay, and this has been a recent MCQ in the entrance exam only regarding the laminas. They are very fond of asking these laminas. Okay, so there is an internal medullary lamina which is separating what? The GP internus from the externus. Okay, so we will see all this in a photo, don't worry. So GP internus and externus are separated by internal medullary lamina. Very easy, very clear. Internum means inside the Globus pallidus there is a lamina between internal and externus. Very simple. Now within the within the lentiform nucleus, I told you there are two parts, the Globus pallidus and the Putamen. So between the Globus pallidus externus and the Putamen, there is external medullary lamina. Okay, again very simple. Okay, again medullary lamina only, but external between the Putamen and GP. Okay, next part of the corpus striatum is the caudate nucleus. Now caudate means coma, so like a coma shaped in this way. Okay, so it is in the form of a coma shaped. You can see this is the head, body and then tail. Okay, so this is the coma shaped nucleus which you will see. This is the caudate nucleus. I will show you in the schematics in a while, don't worry. Now there is a term which is known as neostriatum or also known as striatum simply. So that means caudate nucleus plus Putamen. So now see the twist. We are not talking about the GP, we are talking about the Putamen and the caudate. Okay, so these two are together known as neo. Okay, and GP whole internum externus is known as paleo. The word is striatum, the word is striatum. But if you are only saying in the question striatum, so that only itself means we are talking about the caudate plus Putamen. Okay, so it's a combo which we are talking about. Okay, be very clear about this corpus striatum versus striatum. Okay, then other parts like claustrum, again gray matter only, amygdaloid body, that is a part of limbic system, we will understand eventually. Then red nucleus, substantia nigra, subthalamus. You will be hearing these words eventually again and again. Now substantia nigra itself has two parts. One is the pars compacta, which is the dorsal part, pars reticularis, which is the ventral part. Okay, so you may or may not recall the ventral reticularis and compacta specifically, but just remember substantia nigra. Okay, and this is related to the Parkinsonism, the dopamine, which you have studied in the physiology. Okay. Now see another terminology. Now you will see in certain textbooks the words are mentioned striatum and pallidum, which I just told you previously, right? Now I told you the dorsal striatum itself means the caudate plus putamen, which I told you striatum is equal to caudate plus putamen, simple. The dorsal pallidum is also known as globus pallidum. So what I told you till now is the dorsal pallidum, dorsal striatum. Okay. In higher textbooks of neuroanatomy, you will find the word ventral striatum, and it has certain new terminology which you have not heard till now, that is nucleus accumbens and olfactory tubercle, which is a part of striatum, ventral striatum. And this is given in the Gray's 42nd edition, latest one also. The pallidum again, ventral pallidum has the anterior perforated substance. Okay, the anterior perforated substance, posterior perforated substance, there are some things which will come again and again. Okay, so that is the part of the ventral pallidum, the APS, anterior perforated substance. All right. Next we see the functions of basal ganglia. So why we are discussing all this story is we should understand what is the function of this entire nuclear group. Number one, planning and programming of voluntary movements. Okay, I will give a very good example, you will be able to recall everything. Okay, so just see, planning and programming of voluntary movement, speed and range of the movement, then alters the muscle tone by preventing the unwanted muscular activity, very essential. Okay, otherwise there will be like tremors as you see in the patients of Parkinson's disease. Okay, now just example, you play cricket, you might remember a bowler. Okay, suppose if he has to catch a ball, okay, now what will he do? His basal ganglia will get activated. He will plan that where should I keep my hand. He should program the movement, this is a voluntary movement, right? So planning and programming of the voluntary movement is done by the basal ganglia. Then speed, how much far should I take my hand, or how much should I run back. Range of the movement, should I keep my hand here or here or here. So range of the movement. Okay, I am just giving a very wild example, there are n number of examples you can think in the daily routine life. Alters the muscle tone. Suppose if I am holding my hand like this, there shouldn't be any unwanted elbow flexion or something. It should be stationary and catching the ball, right? So this is an example where you will remember the functions of basal ganglia: planning and programming of movement, speed and range of movement, alters the muscle tone to prevent the unwanted muscular activity. Okay, so if suppose any of these things is distorted or not working fine, then there will be some tremors as in the case of Parkinson's disease. All right, now see this image taken from the Gray's Anatomy. Okay, now have a look at orientation before I show you the 3D animation. See, this is how it looks like. This is the lentiform nucleus lateral part which we are looking at. This is the putamen. You remember the lentiform nucleus, globus pallidus and putamen, right? So this is the putamen. Okay, then you see there is the caudate nucleus, the caudate nucleus, which you can appreciate here is the head part of caudate nucleus. Then you have the body of caudate nucleus, then tail of caudate nucleus, and then amygdala body, which we discussed. Immediately behind, or I can say medial to the this putamen, there is the structure that is a thalamus. Okay, so I told you, if you remember the first statement when we began this class, the topic first line was basal nuclei are located lateral to the thalamus, right? So you can see thalamus is placed medially. Obviously medial placement is a thalamus, lateral to it are the basal ganglia, all these structures. Okay, so this is the thalamus. Now see and appreciate, between the thalamus and the lentiform nucleus and the caudate nucleus, you can see intervening fibers of internal capsule. Dotted lines represent they are behind, or I can say between these two structures, sandwiched between the thalamus and the putamen, which is visible here. Okay, now see, understand this in another way. Just see this section first. So this is schematic horizontal horizontal section of the brain, okay, representing the same facts. Now see what is shown here. The caudate nucleus head. This is the most famous diagram which you will practice, draw. I think this is very easy to redraw, okay, because if we keep on drawing every diagram, we won't be able to complete this very quickly, okay. So head of caudate nucleus, you can practice through this diagram. Then this is the thalamus which is represented here. This is all these things which are visible in the horizontal section, okay. Then this is the lens shaped lentiform nucleus. Now see and appreciate, there are medullary lamina, okay. There is an internal medullary lamina, external medullary lamina. I think now you can recollect which is the medial, which is the lateral, right. So this entire region is the medial part. So this is what? This is globus pallidus. This part would be known as putamen, right. So we have, if we go from medial to lateral in this manner, so you see first of all internal capsule with its anterior limb, genu, posterior limb, okay. Then you see the lentiform nucleus where you appreciate the part here. This is the globus pallidus with its GP internus, GP externus. Then putamen, this part is putamen which we are seeing in the section in this manner, okay. This is the putamen which we are looking from the lateral view, all right. Then you see outside the lentiform nucleus, very important MCQ, recently asked image based question in INI-CET AIMS pattern exam. This thing was asked. This is again the white matter only. What is this? This is an external capsule, okay. So just remember, very easy thing, internal capsule is something enveloping something, right. So lentiform nucleus enveloped by, or I can say the subcortical mass of gray matter, enveloped internally by internal capsule, enveloped externally by external capsule, all right, very easy to remember. Then move more laterally, you will find this piece of gray matter here which is known as claustrum, again the components of the basal nuclei which we discussed, right. Then you have the structure just lateral to it which is not shown in this image. I am telling you an extra point. Here you see another white matter present here. What is that? This was internal capsule, this is external capsule. So lateral to the claustrum will be the extreme capsule, that is again white matter. Then lateral to the extreme capsule you would have again the cortex which is again the gray matter. Now that cortex would be known as insular cortex, okay. Insula, you remember the fifth lobe, oh, sorry, it's not visible, you can see insula, okay. Insula, that is the insular cortex. So that is the fifth lobe of cerebral hemisphere, if you remember, right. So that is the structure which is outside the extreme capsule. So I am just repeating for a recap: internal capsule, GP internus, GP externus, putamen, external capsule, claustrum, extreme capsule, outside this extreme capsule, then even outside this there will be the gray matter which is known as the insular cortex, okay. So this is the arrangement of things which you will see in a horizontal section, all right. You can see in another section, a longer section, the tail and the head. Do you remember the previous photo? Just have a look at this. That's why I kept them side by side. When you will get these PDF notes, it will be very easy to remember, okay. So just see this, like suppose this is the, okay, I give you an example. Suppose this is representing the thalamus, okay. So in a serpentine manner, if you can see in a serpentine manner, this is something which is overlying it, okay. What is that? That is the caudate nucleus, but the relation is not just immediately above it, it is a little bit, I can say, lateral, okay. I will show you in 3D in a while. So this is the caudate nucleus, comma shaped, and then you have the amygdaloid body, okay. So now let us see before I proceed further, let me show you this, okay. Skeleton, let us remove. Okay, I'm removing one side of the cerebral cortex. All right, so now you can visualize all these structures, just the cerebral cortex has been removed. Okay, obviously the meninges and everything. Now see what is this structures which are visible. Very beautiful animation, I would say, to understand these things better, and animations will help you always to gain more concepts. Okay, one more photo I need to show you before I dive into this. All right, now see, I told you in the beginning regarding the corpus striatum. This corpus striatum, I told you, is having the striated appearance. Okay, so the head of the caudate nucleus and the lentiform nucleus, they are separated by internal capsule, I explained in the beginning, and they remain interconnected at places by bands of gray matter which are known as cellular bridges. Again, I told you with the help of the fingers examples. This appears in histological sections, and this gives the entire nuclear mass a striated appearance, and that is known as corpus striatum. So this is a textual format which you will get to write in the exams and solve any n number of MCQs. Have a look at this photo which has been taken again from higher textbooks of neuroanatomy. You can remember the putamen, similar picture which we saw previously, schematic. You can see the caudate nucleus, head, body, tail, amygdaloid body, same structures which we saw. What else you can see? Now can you appreciate this ventricular system? Obviously we have removed the cerebral hemisphere of one side. We will be able to see the ventricle. Which ventricle is this? This is the lateral ventricle. We have already discussed the lateral ventricle if you remember from the previous video. Okay, now see, there is interconnected things between the caudate and the putamen, as you might be expecting. So this interconnection is known as cellular bridges. Between the cellular bridges you can see gaps. What is the thing passing between the gaps? I told you just now. Yes, that is the internal capsule, correct? So I hope you get an orientation regarding how the structures are located. Okay, and nucleus accumbens is located somewhere anteriorly. Again, not to remember, no one is going to ask you. Now please pay attention to this photo. Okay, now this gives you again a very good orientation. Now first and foremost, is this a coronal section or a horizontal section? You can get this hint on the side. This is the coronal section. I have fused two images for you to understand which section is this, otherwise you can see isolated images. I have given this also sides. Okay, so coronal section. Now see, coronal section in length would be less in height, first of all. Horizontal section would be a larger section. I will show you in a while. Okay, now see, there are certain structures which we already discussed previously. Okay, this is the corpus callosum, lateral ventricle. Okay, the same things which we discussed previously. Now see this mass of gray matter which has the internal capsule intervening between the two. This is the caudate nucleus and the putamen, caudate nucleus and the putamen, which is visible here. As you are expecting, there is cross striations between the two because of the intervening internal capsule fibers. Okay, I hope it is very clear to you. This is much more visible here in this photo. Okay. Now before we come on to this another section, let me just show you this 3D animation. Okay, now see, can you visualize the things in 3D better? Maybe yes. Before I even start labeling them, what would be this one? This would be the lateral ventricle, the C-shaped lateral ventricle with the horns which we have discussed. This would be the posterior horn. Okay, posterior horn. Then this would be the anterior horn. Then this would be the inferior horn or the temporal horn. Okay, so even if I just remove this, now can you see and appreciate some things here? Okay, see this part. This is very interesting. This is the part which I want you to emphasize and remember. So this is the C-shaped caudate nucleus which we are seeing with the cellular bridges. Spaces are showing the places where the internal capsule fibers will be running. Okay, and that is not possible on this 3D animation, internal capsule, so that is not shown. What would this be from your previous photos? This would be the putamen. And if I dive in medially to the putamen, I should be seeing the other structures. All right, so now see this, this is the choroid plexus. Let me remove. Okay, this is the corpus callosum. I hope you know the corpus callosum, right? The genusplenium, rostrum we have all discussed. We will be discussing the white matter separately, so I am removing that from this picture. Okay, corpus callosum hidden now. Okay, let me remove this indusium grisum which is in the callosal sulcus. Let me move this again. What this is visible, this is the septum pellucidum which we have already discussed. So now we have better clarity. Now you can see another structure here. Let me remove that also. This is the fornix. Okay, now you can see the structures medial to the putamen. Okay, so this is the putamen. All right, if I just, okay, I will just put it faded. Yeah, you can see better. Now see, medial to the putamen, caudate nucleus, everything, what is the structure? That is the thalamus. Okay, so this has further nuclei which are shown here separately. Okay, there are different nuclei. So this is the structure which is ovoid, in shape, which we will discuss separately. So this is the thalamus. Okay, and we have two thalamus on one side each. Okay, so I hope you got this orientation. The thalamus is medial, putamen, globus pallidus, this is all lateral, caudate nucleus again lateral but superiorly. So when you see a section, you can expect the cut section. See, there can be n number of sections asked to you in any format. They can either cut this section in a coronal plane, they can give you a horizontal section. Okay, and there can be an MRI image, there can be a real-time cadaveric image. In the Viva also it is asked. It is a very common area which is tested from all sets of students. So this should be very much embedded in your brain. What all parts will be visible when I take a section in the midline, across the anterior to the midline, posterior to the midline. Okay, next we come back. So this is another section which you can see. Okay, better visualization. Okay, now you see this again, same things, the lateral ventricle which is visible here. Okay, with the choroid plexus. Now see, the third ventricle cavity is also visible. This is the caudate nucleus. Then you have this part, that is the lentiform nucleus. This is shown as the thalamus. Okay, so this is the thalamus. So we can see thalamus, caudate nucleus, lentiform nucleus, and you can see other things lateral to the lentiform nucleus. Here, okay, medial to the lentiform nucleus, this is the internal capsule. All right, this is the internal capsule. Then here is the external capsule. Then you have the claustrum. Then you have the extreme capsule, and then you have the insular cortex. So let me highlight for you to remember: insula, claustrum, extreme capsule, external capsule. Okay, these all things we have discussed. Internal capsule. Okay, then this is the caudate nucleus, thalamus. Okay, that's it. And yeah, lateral ventricle we have already discussed, third ventricle. Okay, putamen, the internal medullary lamina, external medullary lamina. Okay, and then the body of the lateral ventricle which we have discussed. Okay, you can forget this zona inserta right now for this time being, we will discuss in a while. This is showing the fields of foral actually, H1, H2. Okay, you can skip that, not a problem. Okay, then you can see yeah, so that's it. I have highlighted the caudate, the thalamus, okay, and then the region which we have discussed here. So this is the nutshell which you have to remember from any kind of coronal section of the brain. Okay, you can see this corpus callosum also, which is important. Okay, so these are certain important areas, and if you remember, thalamostriate vein and stria terminalis also we have discussed in the topic of lateral ventricle relations. Okay, all right. Then we come on to this section which you might be waiting for. Now this section is showing the horizontal section. Now let me just zoom out and show you. Can you appreciate this horizontal section here? Don't go for the reading of the labels. Just see this kind of picture where you can appreciate we are taking a horizontal section, horizontal plane. Okay, they have to shown you two different sections. You can go through and read the areas, but I want you to understand few things in this section first. This is given at a different level. Here the level is different. This is the level. This section has been taken from Meckman's Atlas of Anatomy. Okay, and that is again a very good textbook, I would say, for the real time cadaveric specimen images. So do not miss that. Okay, now see, again we will see the same things which we have discussed, but a little bit difference, added points. See, some things which will be connecting the two cerebral hemisphere, that would be the corpus callosum, but there will be the fibers which will be anteriorly running. So there will be smaller fibers from the anterior end and larger fibers posteriorly running. So these are representing, or you can say appearing to be in the form of a forceps. So this is the forceps major and this is the forceps minor. All right, forceps major, forceps minor. There are other fibers also which are of the corpus callosum again, which are the tapetum. So you can see these fibers of white matter, obviously these are running in this manner. These are the fibers of tapetum. Okay, so these are the tapetum. Now tapetum word is used for the glistening white appearance. Okay, so classically if you have seen the cat family, any cat which might have come in front of you and you have poured the headlight of the car or a scooter or the vehicle, you might have seen the glistening, the shining eyes, especially in the nights. If not, you have done that, you may be going and seeing the National Geographic Discovery, you might have seen where you see the glistening white, eyes. They have the tapetum layer in their eyes. Due to that, this glistening thing is present, which enhances their night vision. But in human beings, we have taken this same word tapetum to represent these fibers which are very glistening white on a real time specimen. This is an image, but real time when you hold it in your hand, you can see the glistening white fibers. That is tapetum. Now see and analyze. This tapetum would be helping to do what? This tapetum is helping to connect the which lobe? You can see the temporal, that is the auditory input, with the visual input occipital. So auditory visual sensations are being connected with each other by this tapetum fibers ultimately. Okay, and this is also nothing but connecting between the two cerebral hemispheres. Okay, all right, then we come on to the same thing which we have discussed just now. So you can see this part here, this is representing a structure and this is representing a structure. So this is the thalamus, this is the caudate nucleus. Okay, then you have this is the lentiform nucleus. Okay, this is the lentiform nucleus where you can see this is the GP, this is the GP, that is the globus pallidus, this is the darker part, this is the putamen. Okay, next if I zoom in and show you, I hope you can see very clearly. Can you see a very thin strip of gray matter here? I am removing the highlight, right? This is referred to as the claustrum. Whatever I am telling you, you can later on cross check in the notes. Very easy to revise, right? You have everything in front of you, the labels, the numbering to revise. Okay, and I have not highlighted anything here just so that you can revise better. Okay, all right. Now you see this is the claustrum. Can you help me with the white fibers names here? Three kind of white fibers. This would be the internal capsule, this would be the external capsule, this would be the claustrum, gray matter, then there will be the extreme capsule, then this cortex, which you can see this cortex is the insular cortex. If you remove these lobes, if you open the operculums of the cerebral cortex from the lateral sulcus, you can visualize this part. This is the insular cortex. Can you pay attention that I am repeating this again and again, so you can understand how much important this is. Okay, all right. Then we come on to the next. You can see this for some people extra information. So this is the fields of Forel. Okay, you can read through it. Sometimes it is asked, if your Viva is going good, MCQs are some different MCQs are framed. So the same relations only, okay, regarding whatever we have discussed, lentiform nucleus, thalamus. See, there are connections bit of the basal ganglia, right? So same things, colostrum, internal capsule, extreme capsule, insular cortex, same things which we have discussed. Now what we have shown here is the internal capsule, okay. Now see the connections of the basal ganglia. What is happening? There are some fasciculus which are formed. Okay, one is the ansa lenticularis, the fascicles containing the fibers connecting these two areas, that is the thalamus and the GP. Okay, and then you have the zona incerta, and then you have the subthalamus. Subthalamus plays a very important role in the functioning, which we will discuss in a while. Here you can see these fibers are winding around in this manner, crossing through the internal capsule fibers. These communications are known as fasciculus lenticularis. Okay. Then you have ansa. You remember the ansa cervicalis? Ansa means a loop basically. So they are forming a loop because around this internal capsule fibers, that is the internal capsule fibers in blue color which is shown, some fibers are some connections fibers are piercing through the internal capsule, some are winding around. So this winding around is producing the looping, that is producing the ansa. Okay. Now see, the fields of ORL is nothing but the nomenclature given to these fibers where they are passing through. So first one is, you can see this is the H1 bundle. H1 includes between the zona incerta and the thalamus. So this is zona incerta, this is thalamus. Between this area, the zone becomes H1 zone. What is the fiber? That is the thalamic fasciculus which is running between them. That is fasciculus lenticularis, ansa lenticularis, and the dentato-rubrothalamic tract. Okay. Dentate nucleus we will discuss in a while. Rubro is red nucleus. Thalamic again related to the thalamus. Okay. So the fibers which you can see in the H1 zone, they are comprising of these three things. Okay. Similarly, H2 zone is between zona incerta and subthalamic. So this one is the H2 zone, which has only the one, that is the fasciculus lenticularis, this one FL. All right. Then you have this H zone which is along the caudomedial margin of the zona incerta. This is again an extra information, don't need to panic. Okay. FL plus AL, that is fasciculus plus ansa. So both of these are present in this H zone. Okay. Alright, then we come on to the main part, that is the corpus striatum connections. Okay, connections of the corpus striatum. This table I am skipping because this we have already discussed in the form of the different areas which we have talked about. Next we come on to the connections of the corpus striatum. Okay. So in this we have to understand the afferent and efferent connections. Okay. So I hope you know afferent connection and efferent connection, meaning something which is coming towards the basal ganglia or the corpus striatum specifically now, and efferent means going away from the corpus striatum. Okay. So now the first thing which we remember, neostriatum, which was comprising of caudate plus putamen, we already discussed. So there are fibers which are afferent, means coming towards the corpus striatum. So they will come from some place, right? So number one space which they are coming from is the cortex. So they are corticostriate fibers. Then we have thalamostriate coming from thalamus. Then we have nigrostriate. So very easy. Nigro means substantia nigra. Substantia nigra, the fibers are coming towards this area. Then you have efferent. Now efferent is very easy again. Efferent is from the striatum to some place. So now striato we are talking about the neostriatum, caudate plus putamen, to the pallidum. So striatopallidal fibers which go to the GP. So finally the efferent is received by the GP, globus pallidus. I will show you in the photo in a while. Then talking about the paleostriatum, most of the afferent which is coming from the neostriatum only. So from where is the paleo? GP is getting the afferent from where? I told you just now, it is getting from the neostriatum. So the most of the fibers from neostriatum, they are forming the afferent for the paleostriatum, that is the pallidum. Then efferent fibers from the GP, that is the pallidum, is going to where? It is going to thalamus, hypothalamus, subthalamus, red nucleus, olivary nucleus, we have discussed olivary nucleus, substantia nigra, reticular formation, all that nuclei. So this connection is the efferent connection, and that is by the ansa lenticularis, we have discussed just now, fasciculus lenticularis we have discussed, and the subthalamic fasciculus. Okay, so now you see this photograph, it will make much more sense to you, I guess. Okay, so first let me zoom in. You can see number one, the three things in relationship right now. Let me just highlight. One is the caudate nucleus, thalamus, putamen, and globus pallidus. Okay, so this is the raw material which we need, okay, along with this subthalamic nucleus. All right, then you even have the reticular formation shown here. Then you have the red nucleus, substantia nigra, inferior olivary nucleus. So these are the raw materials along with the cerebral cortex. Now we need to understand the connections or communications between them. Very easy, now we already know most of the things. So first let me find that the GP, that is the globus pallidus. So this part should be the GP, pink color which is shown here. It should be receiving the fibers or the afferent from the neostriatum, and neo is comprising of caudate and putamen. All right, so now you see very interesting and easy connections, if you can appreciate. Cortex, cerebral cortex, corticostriate fibers from cortex to striatum. Then these are connecting to the other part of striatum, that is the putamen. So that is a corticostriate fibers, even directly also they are reaching the putamen. Okay, so this is the first bundle, corticostriate fibers. Next we have thalamostriate fibers, okay, from thalamus to both the places of striate, okay, that is a neostriatum. Then you have the third communication, if you see, cortico, thalamo, last one is the nigrostriate fibers. Now you see the nigro, this is a substantia nigra. We have discussed substantia nigra, if you remember. Substantia nigra, this is nigrostriate. So from the nigro, it is going to the striate. Okay, so that is again putamen only. So nigrostriate. So now we have received all the afferents into this and this. Okay, now we have to send the efferent from the neo to the paleo or the pallidum. So this is shown, that is a striato-pallidal fibers, easy. Now we talk about the pallidum. Now pallidum has received most of the fibers from the neostriatum. I hope it is crystal clear to you. Now we are looking at this part. We have to send the efferents out of the pallidum. Now you see, entire pallidum is sending so many efferents to multiple places. Okay, now you see the names: subthalamic fasciculus, okay, to the subthalamic nucleus. Then you have this, again this bundle, ansa lenticularis. Then you have fasciculus lenticularis. Similarly, thalamic fasciculus. You remember thalamic fasciculus had this fasciculus lenticularis, plus there was another thing, that was dentato-rubrothalamic tract, if you remember, right? I told you previously. So here you have the subthalamic nucleus, here you have the rubro, that is the red nucleus. So efferent will go to the red nucleus, efferent will go to the reticular formation, efferent will even go to the substantia nigra. Okay, so this is substantia nigra. Efferent will also go to the inferior olivary nucleus. So efferents are shown in red color here, very easy to remember. Okay, so if you want, I can write this: efferent is shown in red color, so that you remember later. Efferents red and afferents afferents are shown in green color, okay, in this photograph which we have seen. All right, okay. Next we come on to now we know the connections of basal ganglia. Now we need to understand the direct and indirect pathway concept. Okay, it's a very important concept, and you can remember this pathway with the help of this mnemonic, that is the MCNIT. Okay, this is a very good information which you can remember. Okay, color coding is to be followed. Just remember this MCNIT abbreviation for easy recall regarding the pathways of basal ganglia. So this you study in physiology also, it is very important. Direct and indirect pathways simply means turning off and turning on the cerebral cortex. Okay, now you see turning on, direct pathway, we are switching the motor cortex on, that is direct. Okay, now what is happening to turn the motor activity on? We need to turn off the inhibition. Okay, so turn off the thing which causes inhibition, that is the catch point. Okay, then see this comprehensive diagram which shows all the pathways. Okay, so now you focus first one on this pathway. So pathway contains MCIT pathway, direct pathway is also known as MCIT pathway, easy to remember. Motor cortex, let me zoom in. Okay, right, just have a look. The motor cortex M, striatum, that is S, I is for internus, GP internus. Okay, T is thalamus. So this is MCIT pathway, very simple, this one which I am tracing now, and then again back. This is MCIT pathway. Indirect pathway includes MSIT, though it is there, but there is extra, that is EN. So EN is extra. EN is extra in this indirect pathway, and whereas you have direct pathway which has the MCIT pathway. Okay, MCIT. So MCIT may we have added EN extra. Okay, we have added EN. Now you see what is E and what is N. E is externus, GP externus. Internus was already there in the mnemonic, right? Then you have nucleus, that is a subthalamic nucleus in the pathway now. So now you can see regarding this pathway, you can appreciate there are three neurotransmitters. One is the GABA, then you have the glutamate, and then the dopamine. Okay, now see, if you remember, GABA is inhibitory, glutamate is excitatory. Okay, dopamine is the one which is related to the nigrostriatal pathway, if you remember, right, substantia nigra. Now focus on the direct pathway first. So we are talking about turning on the motor cortex. So the movement has to start, that is done by the direct pathway. Okay, movement has to stop, that is done by the indirect pathway. Now let us see how. See, cortex is helping to via the glutamate, it is having a positive effect on the striatum. So what is happening? Striatum is getting excited to release the next in line, that is the red one is shown as GABA. So cortex is stimulating, now please listen carefully, cortex is stimulating the striatum via the glutamate to secrete more GABA, and GABA is inhibitory. So net effect will be inhibition. So GP internus, whatever it is doing, it will be decreased, that is inhibited. So it was actually secreting the GABA, so that GABA production will decrease. Okay, I am talking to you in a very crude manner, very easy manner. GP internus will be inhibited, so GABA here in this region, GABA will be less. So less GABA, more of action will be there. So thalamus is fairly activated for the motion. So that is producing, again activated by the glutamate. Again cortex is turned on. So motor activity is performed. See the opposite case scenario in case of indirect pathway. What is happening? Cortex is again stimulating the striatum via the glutamate. Striatum is increasing its production of the GABA. GABA is inhibitory. So GP externus is inhibited. So GP externus has to secrete the GABA. Now GABA is formed less, right, because the inhibition has been there in this region. So GABA is secreted less. So subthalamic nucleus functioning is more. So glutamate is more, it is excitatory. So what is happening? GP internus action, that is to secrete again GABA, that is increased. So that means this thalamus is having an inhibitory. So here GABA will be more, here GABA was less. So here GABA is more, so thalamus is having an inhibition. So that means the thalamus is telling the cortex to stop the motor activity. Okay, so this is the two pathway, direct pathway versus indirect pathway. Now see the catch points. Achha, if you don't remember any of this story, just remember this mnemonics to ease your life. NEET pathway, first and last are excitatory. Okay, if you see, first and last are excitatory, this one and this one, right, and everything in the middle is inhibitory, right. You saw this already, that everything in the middle was inhibitory except for the subthalamic nucleus. So here can you appreciate the subthalamic nucleus is producing the glutamate. So what is happening? There is action, which is the more the glutamate is formed, so there is activation of GP internus. Okay, so what is happening? Ultimately first and last are excitatory, everything in the middle is negative except for subthalamic nucleus, which is positive. Okay, so this is a very simple thing which I have shown you here, the direct and indirect pathway. Now understand the clinical applied anatomy of this. Okay, so if I need to do any movement, this is started by or begun by this direct pathway and stopped by indirect pathway. That is a normal case scenario. Suppose subthalamic nucleus is having a lesion now. Okay, suppose this is having a lesion. Okay, I will discuss in a while. So there will be loss of this activity here. So what will happen? This thalamus, which was to get inhibited, will get activated. So now there will be unwanted activity which will be happening, which should not be happening otherwise. So that is an example where you see the Hemiballismus. Okay, Hemiballismus MCQ is asked regarding the subthalamic nucleus affected. Okay, then where is the third one? That is the dopamine. We have not discussed about this. See, just remember, like a very old door in your house, if you need to, that it's having a creaking voice, it's not moving smoothly, what you will do, you will put an oil, okay, maybe mustard oil or any oil, the noise will reduce and the movement will be fast and fluid and smooth. So just understand that way, that in this direct and indirect pathway, dopamine with the help of this Substantia nigra, this nigrostriatal pathway, this is helping as a smooth coordination of these activities of direct and indirect pathway, simply put. Okay, now see the disorders. The first one which you can see is the Parkinson's disease. Parkinson's disease, that is also known as paralysis agitans. Okay, then you have the chorea, athetosis, Hemiballismus and Wilson's disease. Okay, I have put everything on one place so that you remember, and the only key points. Okay, not any too much lengthy informations. Okay, so as you know, Parkinson's disease is neurodegenerative disorder. Okay, I don't like anatomy without the clinical anatomy, it's totally useless otherwise. Okay, so you have to remember the clinicals, link every anatomy fact to the clinical applied aspect of that. That is much more relevant to you as a doctor, as a clinician, as well as for your MCQs, theory exams, Viva exams, everywhere it will be useful. You cannot skip clinical, and if you by chance skip it, we will teach you in another subject. Parkinson's will be taught to you in medicine. Here again you will study the same facts, then you will recall the anatomy. It is from the basal ganglia topic. Now see this beautiful image showing all these features of Parkinson's disease. Dementia, loss of memory, then mask-like face, okay, expressionless face. Then you have reduced arm swings. Okay, let me highlight the most important ones. The stooped posture is the most important one. Stoop posture, the patient will be leaning forward. Okay, then there is pin rolling tremors of the hand. Okay, pin rolling tremors of the hand, resting tremors. Basically Parkinson's is famous for resting tremors. Then lead pipe rigidity, mask like or expressionless face, stiff shuffling gait. Okay, dementia. So these are the few most important areas which will be tested in your exams. Okay, and a very quick short brief understanding that this Parkinson's is actually a group of symptoms, and you can remember this by the help of a triangle. Okay, just remember this with the help of a triangle, where you can see the first one is bradykinesia. Okay, then you have tremors and stiffness. Okay, these three features are very important for the Parkinson's disease. Okay, now you see lesion of basal ganglia, deficiency of dopamine, lack of inhibition of corpus striatum, ultimately extrapyramidal symptoms are being produced. Okay, you can see all these things, resting tremors and cogwheel rigidity, mask like appearance, whatever we have discussed. Okay, next we come on to the chorea. And treatment part includes the levodopa, okay, or surgical reduction of the globus pallidus, you can remember. Alright, then you have the chorea. Now chorea is very importantly, you can remember this keywords here: brisk, jerky, purposeless movements, as seen in Sydenham's chorea and Huntington's chorea. You will study details in medicine. Okay, then athetosis is slow, writhing, worm-like movements. Okay, typically of the fingers and the toes. Okay, worm-like movements, just like this. Okay, worm-like movements of the fingers and toes. Okay, chorea is brisk, jerky movements. Okay, purposeless movements. Okay, Ballismus are violent. Ballismus is violent, involuntary flinging movements due to the, again now see very important line, due to the lesion of the subthalamic nucleus. And this is the most important statement which is asked in the MCQs. Okay, and you can remember there is another terminology that you might have heard, that is the hemiballismus. Okay, one side is infected. And now you see Wilson's disease, that is a genetic disorder of the copper metabolism leading to hepatolenticular degeneration. These are the very famous words. Okay, with KF rings in the eyes, so in ophtho also you study. Then with motor and psychiatric symptoms. So that's about the basal ganglia which we have discussed in detail. So please remember this very important topic. Next we come on to the lateral ventricle. Okay,